Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and I want to welcome you back to our YouTube channel. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Today's topic is so exciting. Finally, we get to talk about dysmenorrhea, which all of us know is about painful menstrual cramping. So when women are on their periods, it hurts a lot. If you've never joined us before, we upload 1 to 2 videos a week with an emphasis on integrative medicine approaches to different medical topics. So if you haven't subscribed, please do so. Hit the notification bell so you know when we've uploaded our next video, and give this video a thumbs up if you like it. How we're going to organize this video is that Dr. Lucio is going to do a basic overview of dysmenorrhea or painful menstrual cramping. After that, we'll talk about the conventional ways that we usually treat dysmenorrhea and 6 alternatives on how you can control your menstrual cramping so that you have less time off from work and less time missing school.
So today, first of all, I'm just going to be covering some just basic definitions just so everybody's on the same page and they understand what we're talking about. Dysmenorrhea is really just a medical term for cramping, pelvic cramping during menses or during the woman's cycle. And it can manifest in, not, as I mentioned, the cramping, but they can also have low back pain, pain in the anterior thighs, vomiting and nausea. So it's not just the uterine cramping that manifests in the symptoms. It occurs typically 1 to 3 days before the onset of the cycle, and it can occur a few days afterwards as well. And when you think about this, it really should be divided into 2 types. And one's a primary dysmenorrhea, which is basically there's no other medical condition going on. It's just simply an issue with the uterine cramping during the menses. And there's also something called secondary dysmenorrhea. It's typically caused by something else like pelvic inflammatory disease or cervical stenosis. And today we're going to talk more about the primary dysmenorrhea part of it. It actually occurs anywhere from 15 to almost 75%, depending on which studies you read. And 25 or 23 to 25% of the women report that they characterize it as pretty severe. So it's a pretty significant number of people that can get it. It tends to be more significant in women who tend to have their period at an earlier age, and those have very heavy bleeding or prolonged menses also tend to be more prone to dysmenorrhea. Smoking has been associated with prolonged pain. Alcohol, interestingly enough, does not increase your probability of getting dysmenorrhea, but it does make the symptoms worse if you already have it. Also, people, it doesn't increase your probability of getting dysmenorrhea, but if you do have dysmenorrhea, it can make those symptoms worse.
What?
Alcohol.
Oh, alcohol.
Yeah. History of sexual abuse, psychological symptoms can also folks are more prone to have dysmenorrhea, and chronic exposure to stress, as always, tends to make that worse as well. Also, exposure to secondhand smoke. So you don't actually have to be smoking, but secondhand smoke can also increase your risk of getting dysmenorrhea.
Like Dr. Lucio said, it's really, really important to see your doctor because you want to make sure that you just have basic primary dysmenorrhea. Primary dysmenorrhea means you have nothing wrong in your body. It's just that because of the menstrual flow, you're having a lot of cramping of the uterus during the menstrual flow. Secondary dysmenorrhea is something your doctor really needs to tell you if you have, and that's when you've kind of investigated the primary dysmenorrhea. We've done a thorough pelvic exam, thorough physical exam, and we've used the traditional treatments and they still aren't working. And at that point, we kind of ask ourselves if you might have something in the secondary dysmenorrhea route, which means that you might have uterine fibroids, like you said, or endometriosis. You might also have pelvic inflammatory disease. In those cases, we need you to see your doctor because those are more serious conditions. Whenever we meet someone who has this primary dysmenorrhea or primary menstrual cramping, we always start with conventional treatments. So the most common is non-steroidal anti-inflammatory drugs. They're called NSAIDs because it's just the first letter of each word, non-steroidal anti-inflammatory drugs. These are things like ibuprofen, naproxen, Ponstel, which is mefaminic acid, and aspirin. If those don't work, and those are typically the best done if you can take them before the onset of your menstrual flow. So if you can kind of predict that your period's coming, you see just a little spot of blood, don't wait until the bleeding's really flowing to start these non-steroidal anti-inflammatories. They're most effective if you take them right before the onset and also for 2 days after your period's gotten going. The other thing that we usually have you do if this doesn't work is you can also try hormonal medications. These are things like oral contraceptive pills. Oral contraceptive pills work by decreasing the menstrual flow and ovulation associated with the pain. And as well as doing the birth control pills, these pills are designed for you to have one period a month. They do make pills that let you have a period every 3rd month, but you can also take the pill that gives you a period every month continuously. So you're giving yourself a cycle every 3rd pack. Those are continuous birth control pills use, which is very safe to do. It just may cause a little bit of extra breakthrough bleeding since your body's wanting to have a period every month. The other options that we use with conventional medicine are things like Depo-Provera, which is medroxyprogesterone acetate, and that's given in an injection form intramuscularly. Traditionally, we thought that there was a problem with bone mass, with young women even losing bone density while on it, so we used to have to check a bone density scan every 2 years. That is no longer the case, and all the bone loss that we see in young women reverse immediately when they're off of it, so there's no reason to check it anymore. The 4th option, conventional medicine treatment-wise, is a levonorgestrel releasing system, which, as you guys know, is the intrauterine device called Mirena, M-I-R-E-N-A. And that's placed up in the uterus, providing people with great control of their menstrual cramping because it causes a situation where you don't have periods and no ovulation as well. These types of conventional treatments usually work in 75% of cases, so 75% of you are going to improve with the things I just talked about. But these all have side effects, and that's when a lot of you guys kind of ask us, what kind of alternatives do we have? Well, we have lots of alternatives, and we're going to go through 6 alternatives to the conventional treatments. You can use these along with your conventional treatments. You can use them in place of, so we can just leave it up to you. So we're going to move on to the 6 alternatives to treating your menstrual pain. Everything of these 6 things to help you with alternatives are all clinically based trials that have evidence behind it backing them up. The first one is obviously diet, and we always love to talk about the anti-inflammatory diet because the method that you have the menstrual cramping is because of inflammation. So if you follow an anti-inflammatory diet, it really helps a lot. This is eating more vegetables and more fruits and less animal protein, using olive oil. All those things alone will help tremendously. And you don't have to do it all month long. Maybe you just want to do it like 2 weeks before your period. It helps even with PMS symptoms for that. The other thing we'd like you to do is increase your amounts of intake of omega-3 fatty acids, and you can get that through fish like salmon or sardines. You can also just take 1 fish oil capsule a day, which would be 1 to 3 grams of fish oil a day. I'm very kind of hesitant to take fish oil because I think if it looks kind of yellowy and oily, I feel like I'm swallowing a fish and I just can't swallow it. They make a really good Barleans, B-A-R-L-E-A-N-S brand of fish oil. We aren't sponsors of it. They don't sponsor us to talk about it. But these are fish oil that's made in dark blue capsules, and they're orange scented, so you don't feel like you're swallowing fish. So that, for me, helps. Vitamins that are really useful are things like vitamin E, thiamine, magnesium, and zinc. The 4th alternative to conventional medical treatment of crampy periods is acupuncture and acupressure. The 5th is using abdominal massage, where you're just basically massaging your lower abdomen, and you can combine that with or without. You can do it just alone with massage, or you can do it with essential oils mixed in a lotion base or a cream base. If you do the abdominal massage alone, it's just as effective, but for duration of relief of your cramping, if you apply it with the essential oils, it lasts longer. And if you wanted to apply it with essential oils, the essential oils are lavender, clary sage, and marjoram. And they found that if you do both, they're going to help your cramps relief longer in duration than just doing the abdominal massage alone. Also, applying heat to the lower abdomen helps, and the temperature they studied was 39 degrees Celsius. And the last alternative that you can use to help control your menstrual cramping are botanicals and traditional Chinese medicine. Both of them have been used for centuries, and unfortunately there's no clinical trials that we can say, yeah, there's all these clinical trials like the other 5 methods we just mentioned that are alternatives. But this doesn't mean it doesn't work, and people have found success with using botanicals and traditional Chinese medicine for centuries. These are the list of botanicals and with all the doses. And we do caution on 2 of them, so we'll go through them. Botanicals are herbs that can be used medicinally, just like last week's video that we filmed in Oregon, which we really miss Oregon, especially with the Missouri heat. It's so hot.
And Washington, yeah.
Oh no, yeah.
Man, we
We
love both
were
of
in Washington too for his oldest daughter's wedding. We can use ginger, and if you want to use ginger, it is, and there's the dose. It's, what did I say? 1,000 to 1,500 milligrams of the ginger powder every day, and these are in the class of herbs like fennel and thyme, and these are carminative herbs. These herbs are antispasmodic, so they help to decrease the spasm of our uterus, which causes the pain. Another herb that you can try is valerian, and I'm going to read this so I get the dose right, is 255 milligrams taken 3 times a day for 3 days. The other herb is black cohosh, and you're going to do 40 to 80 milligrams twice a day. This is one with caution that you want to avoid if you have liver disease. Another herb is don quai, and you can do 3 to 4 grams a day in divided doses. So in one day, the most you can take is 3 to 4 grams total. But this is another caution medication. It can increase your uterine bleeding, so you don't want to use it if your period's already heavy. You might want to use it if your period's still kind of light flow, because it can increase your bleeding, and especially if you're a woman that's on warfarin, which is a blood thinner. So any blood thinner, just avoid don quai. And the last herb that you can try to help with your menstrual cramping is an herb called black haw. And the dose is 1,000 milligrams of dried root or bark, and you take that every 3 to 4 hours as needed for the pain. Well, we're really hoping this is helpful. We'd love to hear from you, so please comment below what things might work for you or what questions you might have. And what is our next topic going to be about?
Well, we're going to be talking about CBD oil. That's kind of all the rage here in Missouri. We use it sometimes with people with chronic pain and when they have difficulty sleeping as well.
Is lavender, clary sage, and marjoram. Marjoram. 3 essential oils are lavender, clary sage, and marjoram.
Marjoram.
Oh my gosh.
Well, thank you for joining us today. We hope you found this very informative and hope that we provide you some tips that you can take to better your health. And we'll see you next time. Bye-bye.